Welcome back. There's going to be a diabetes and heart disease study taking place at Ben Franklin Place. That's happening Tuesday, February 13th. We have some time to think about it, but never better to think about things than in the moment right now when it comes to your health. And with us right now, Medical Director of the Seeker Center, Dr. Richard Nahas, is with us, and he's also an assistant professor in the Department of Family Medicine, University of Ottawa. That's a lot of titles to bear for one fella. How you doing?
I'm having a great day. Thank you.
It's good to see you here. Now, where exactly is the Seeker Center?
We're on Merivale Road, 942, just around the corner from the Civic Hospital.
Okay. So what exactly happens at the Seeker Center?
Well, we typically focus on chronic pain management, but our interest is in what's called integrative medicine.
Okay.
And that means that we're focused on delivering the best conventional treatment and offering alternative therapies that can be added safely and effectively.
Okay. Now you have this diabetes and heart disease study coming up, Ben Franklin Place. Now, why is there a need for a study such as this?
Well, we were participating in the first trial of this kind, which took place in the early 2000s, and the results were published in 2012. And this study was commissioned by the NIH in the US, which funds all research. And it was funded basically to debunk a treatment that was assumed to be worthless. Mm-hmm. And the investigators and the cardiology community were quite surprised to see the very impressive results that were specifically seen in diabetics. Mm-hmm. So in the first trial, they enrolled people who were 50 and older, who had had a heart attack, and they gave them an IV treatment once a week for 40 weeks. And it was either the real treatment or placebo. Mm-hmm. And they demonstrated a very impressive reduction in death and recurrent heart attack and other really important heart-related outcomes.
Okay.
So this study is a follow-up trial to confirm that in diabetics, that benefit is real.
Okay.
And if it replicates the findings of the first trial, then chelation therapy will become available to many more people.
Okay. So chelation therapy, how new is that type of therapy?
Well, it's been done anecdotally since the 1940s.
Okay.
And it was developed as a treatment for lead poisoning because this substance called EDTA binds metal and pulls it out of the body. And lead is one of the most toxic metals that accumulates in all of our bones throughout life. So particularly for people who are older, who were around before lead was removed from the environment, there's a lot of lead in their tissues. And the thinking, although it's not clear, is that this may be how chelation helps people by removing damaging metals from their bodies.
So why is it so important for you to be involved in this trial?
Well, I'm an advocate for alternative medicine, but I'm primarily an advocate for evidence-based medicine. And it's not often that we see a trial of this magnitude being done in a treatment that is novel and unexpected to benefit patients so much. So we had a great time with the first trial. We were enrolling patients for 5 years, and we're happy to participate again because I think it's a historic development if it turns out as we expect.
Okay. And who would be the best candidate to enroll in a trial such as this?
Well, obviously, you need to have a bit of time on your hands.
Yeah.
Because the treatment is a weekly infusion.
For how many weeks?
It's 40 weeks.
40 weeks.
And it's about 3 hours per treatment. But if you need to miss a week or two now and then, if you're a snowbird, that's not an issue.
Okay.
And in terms of who's eligible for the study, over 50, previous heart attack, and diabetes.
Okay. So it could be a bit of a challenge to find people to come on board.
Oh, you'd be surprised.
Yeah. Unfortunately, maybe I would be surprised, meaning that there's a lot of people that are in maybe difficult health conditions. So they've had heart attacks, they're suffering from diabetes. Is it that big of a problem?
Diabetes is a new epidemic, and the rate of increase of prevalence of diabetes is very concerning to everyone who looks after these patients.
Okay.
So now there are about 30% of people in Canada who are either diabetic or pre-diabetic. And diabetes is an illness that you have to manage on a daily basis. And when you manage it well, you can live a long and healthy life. But unfortunately, the number one cause of premature death and early illness is heart disease.
Okay, about 30 seconds left. How do people get to more information? Obviously, you have this event coming up.
Yeah, we have a presentation that I'm giving at Ben Franklin Place on the 13th of February, just one day before Valentine's Day. And if people are interested in participating in the trial, they can either RSVP for the event, or they can just reach out to us by phone or by email.
Okay, seekerscenter.com is the best place to go to for
seekerscenter.com. Thank you.
Thank you very much, Doctor, for your time and for keeping us healthy.
Thank you.
We appreciate it. And thank you as well.